Researchers think up to 1/3 of people who get COVID get long COVID. Doctors are learning the condition is widely misdiagnosed and the symptoms can be crippling. These are some of the symptoms. Look at this list: heart palpitations, shortness of breath, headaches, trouble sleeping and thinking, stomach pains, joint and muscle pains, cough, rash, and debilitating fatigue. The Minnesota Department of Health has a long COVID program, and Kate Murray is the manager of that program, and she is kind enough to join us now. Thank you so much.
Thanks for having me.
Let me just start with our friend Adam Del Rosso, who is over in the Next Weather Center. He is somebody who actually went to the hospital a few weeks after getting diagnosed with COVID with heart problems. There he is in the hospital. We're glad that he's 100% better now, although he says sometimes he does still feel like his heart is racing. Just talking in the newsroom, our producer, Amanda, who is also in her 30s, said she had the same thing, had to go to a cardiologist, and the cardiologist said, we can't really diagnose this, but we think it's long COVID. What's going on?
Yeah, so what we've learned is that the virus that causes COVID-19 isn't just a respiratory virus. It can actually impact nearly every system of the body. And the symptoms that you're describing may actually be a result of the virus impacting the parts of the nervous system that regulate things like heart rate. So some people do have these heart palpitations or racing heart, especially when they change positions. And that can be really debilitating and anxiety provoking, as you can imagine.
And we listed some of the other, I mean, it seems like anything, and obviously those symptoms can be with a lot of other illnesses, but the Minnesota Department of Health, and I did not know this until I started researching this, has a long COVID program, and you go around the state to talk to clinics and to doctors to educate them about long COVID. How much do doctors need to know, and how much do you think you know about long COVID?
Well, certainly we're still learning. Everyone is still learning. There's more evidence coming out almost daily about this topic, and so providers can struggle to keep up with the latest research as well. And even some of the research is a little bit behind what a lot of folks are doing in clinical practice. So one of the pieces of our comprehensive approach to understanding long COVID and helping folks who are impacted is convening healthcare providers from around the state, like you mentioned. And so that includes specialists and folks from these big, academic health centers and places like Mayo, where they have their own program, but also primary care providers and the others who may be the ones who are first to see and recognize these symptoms in their patients. And so trying to provide this learning community and an opportunity for them to sort of have some consensus around how this is diagnosed and managed. One
of the issues is, do you still test positive for COVID if weeks later you emerge with symptoms of long COVID?
Typically, people won't keep testing positive. There is some evidence that some of the symptoms could be caused by viral persistence, meaning the body is not completely clearing the virus, but it's usually living in places like the gut or other organs. It doesn't mean that somebody is still necessarily going to be contagious.
And we're talking about up to 1/3 of the people who have COVID could get long COVID. That's a huge number. In Minnesota alone, that would be hundreds of thousands of people. What should people do if they suspect this and they've gone to their doctor and perhaps the doctor hasn't mentioned that?
Sure. It's definitely important to monitor your health after you've had COVID-19 or really any severe acute illness, and then talk to a provider, because as you mentioned, these symptoms can really overlap with a lot of other conditions. So it is important that they rule out other potential causes like diabetes, thyroid issues, even something more serious than that. But some providers are able to help manage these symptoms. There's not a cure yet, but there are some interventions that may help someone get back to baseline or adjust to what their new normal is.
And I know that in addition to going around the state and educating doctors and physicians and clinics about this, you're also tracking this, and you've got information on your website, the MDH website, about this. What other things are you doing to try and get a grasp on what's going on with an awful lot of people here in our state, and obviously this going on around the nation?
Yeah, well, we definitely want to get a better understanding of how big this impact is. It's really hard to measure long COVID because it's not just one condition. It's really an umbrella term that describes a lot of different conditions. So there's different definitions out there, and it's not like measuring diabetes or cancer, but we are trying to understand how COVID and people who are recovering from COVID are having impacts long term, and then understanding how does this impact their quality of life, their employment, schoolwork, and then what are some other areas that we can make sure they get that care and support.
And one of the symptoms was fatigue, which goodness knows, especially those of us on the morning shows do feel. I mean, we all feel fatigue right now. But I was interested to read that this is the kind of fatigue that is really debilitating. Can you describe what it is?
Absolutely. There is sort of a certain flavor of fatigue called post-exertional malaise, and that means after doing something even as simple as taking a shower or doing the laundry, you feel like you just ran a marathon. So some people who have that version of fatigue really need like a day or two to recover from basic activities. So that can be really debilitating.
Thank you so much for being with us. We really appreciate your help and your insight, and obviously the MDH is on top of this, and we do have a link to your website. So thank you very much for coming in.
Appreciate it.